Right. Good afternoon, everybody, and welcome to the second seminar of the NIHR School for Public Health Research Network for the use of natural experiments in public health. My name is Famke. I work for the University of Bristol, and I'm chairing this network. So it's my pleasure to invite you all. It's also my pleasure to invite our speaker, Dr. Famke Molenberg, who is doing her first outing as a doctor after successfully defending her thesis 2 weeks ago in the Netherlands, in Rotterdam. And her thesis was on the intervention, the evaluation of the intervention of local public health interventions, I suppose, and she's going to tell us all about her thesis now. I've seen her slides. She will introduce herself in a lot more detail. We would like to have questions and comments at the end of the presentation, but if there is something during her presentation that you really don't understand, feel free to pop it in the chat, and then we'll try and address it during the presentation. So I will ask Famke to slide share and start her presentation. And again, I apologize indeed for mixing her up with the latest Dutch Tour de France day winner. So apologies again, Famke. It's up to you.
No problem at all. I'm honored to be remembered as a Tour de France stage winner, I think, as a public health epidemiologist. But yeah, good afternoon, everyone. It's a real pleasure and an honor to be presenting today at your research meeting. It's very exciting to see so many people being interested in natural experiments. And today I will give a presentation about some of the chapters that were published as part of my PhD defense, which indeed I did 2 weeks ago almost already. Give you an idea of how it looks like. So in the Netherlands, we make a book based on the different chapters that are published or submitted articles, scientific articles, and then we have to defend this in public. And there was even a UK tint on this day because Dr. Esther van Sluis from Cambridge University was one of my opponents. So yeah, this was a very festive day. And today I will tell you more about the contents of the projects that we did. So we'll first give you a bit more of context of my PhD projects. I think that might be of help for you to visualize and know where the questions came from. I will give some reflections on the academic work that we did. I will tell you through some of the papers. I will reflect on how it was to support local policy making and the elements that I think are key to have this possibility. And I will share some ideas for future projects. And this is also really an invitation for you. As I'm lucky that I can stay in academia, I will work for another 4 years as a postdoc on a collaboration between Erasmus Medical Center, our hospital, and Erasmus University with the Department of Economics and Econometrics. So there are lots of new things ahead, and it would be lovely to hear your thoughts and see where potentially we could collaborate on those ideas. But first a bit on myself, how it all started, because I, of course, not ended my academic experience and educational trajectory, but I started with a bachelor in biomedical sciences at Maastricht University. And although I like this a lot, I was not really made for lab work, I discovered. So I was very lucky to experience in one of the courses that there was also something like epidemiology, where you could study populations rather than individuals or cells in a lab. And that's why I went to Wageningen University, where I did a master in nutrition and health with a focus on epidemiology. And then I was lucky again to start as a junior researcher, and I worked for a year at the Department of Nutritional Epidemiology. And I looked at the relationship between dietary fatty acids and disease risk. but as you may know, there are many factors that influence why some eat more fatty acids, saturated fatty acids than others. And I was very much interested in those wider determinants. And then I found this PhD project at the Erasmus Medical Center within the title, The Natural Experiments. I honestly had no clue what this would be. It was not in my epidemiology courses. It was not part of my master training, but it looked very exciting and challenging. And that's why I applied, and I was the one being selected to have this PhD project for 4 years under supervision of Professor Famke van Lente and Alex Beurdorf. So that's how it all started. I didn't really know what natural experiments were, but it looked very interesting to see how those larger changes would influence health. So that was what the PhD project's main aim was to identify and evaluate those natural experiments. And then specifically those looking at population health and targeting populations, because what we see and know from other work is that, well, you can tell individuals how to behave more healthy, but that's really difficult if everything around you calls for unhealthy behaviors. So we really wanted to look at those larger interventions, mainly targeting environments. And we really wanted to support our local policymakers. So what can they do, or what happened over time, and how did it impact health? Well, and this all took place within Academic Collaborative Center SPHR. I think it's important to mention that here. I don't know how your projects are structured or how knowledge networks work in the UK, but this is an academic collaborative center between the Department of Public Health from the Erasmus MC, the City of Rotterdam, and local municipal health centers from the wider region. And together, well, we aim to study things that are important for them, and they can give their experiences to us. So it's really trying to facilitate this conversation. And then quickly, at the start of my PhD, I decided that it would be a good idea to be 1 day a week physically available and present at the City of Rotterdam. This was pre-COVID, of course, so that they know that there was a researcher aiming to help them and to look for solutions and to identify also opportunities where evaluations could be of use. And I think that this 1 day a week was very essential in my PhD trajectory, as I had their ideas and they could bring ideas to me, and I could link it with the academic knowledge that we had at our own department. So this was very, very helpful. The Academic Collaborative Center is called SPHR, which stands for Center for Effective Public Health in the larger Rotterdam area. And their aim is to connect researchers, policymakers, governors, and local professionals to work on a vital city and also to reduce health inequalities. So this very nicely fitted with my PhD aim. So a little bit of background on the City of Rotterdam. Here you can see where the Netherlands is based, between Belgium and Germany. Rotterdam is one of the bigger cities in the western side of the country. It's not Amsterdam, it's Rotterdam. You may know us from the Eurovision Song Contest that was held this year. You may also know us from the architecture. It's the only city in the Netherlands with a skyline. And these are some other facts that I think are important to keep in mind. So we're the second largest city and hosting many different nationalities. Furthermore, it's a very young city. 1 in 3 persons is below 27 years of age. And there are many public health challenges, and there are so many that I didn't want to give you a very depressing image of all the negative numbers from the city of Rotterdam. But this is just one fact that I think illustrates very well the problems that we experience, which is that 17% of the children in Rotterdam are raised in poverty as compared to 8% in the Netherlands. Well, and you can think of all type of health outcomes and determinants that are associated with this. So yeah, there is lots to do, specifically also in the city of Rotterdam. And then another thing is that there are large inequalities between neighborhoods. This is an example. What you see here is status scores. So you see that specifically the southern region of the city experiences high unemployment rates, low income, and lower educational level. And this also led to differences, for example, in life expectancy of 8 years between neighborhoods. On healthy life expectancy that differs for 15 years, and that all within a city of 650,000 inhabitants. So it's not a London or another big UK city. It's relatively small, but there are large differences and inequalities in health and health behaviors. And then we wanted to focus on this environmental focus. This is just one example of a paper that I very much like, because these are the type of phrasings that also our local policymakers have, like, yeah, we want to reduce, minimize, stabilize health in the population, but they hardly discuss how we should do this. And I agree with the authors of this paper that it's very valuable to look at those environmental interventions rather than individual responsibilities. So this is what we wanted to support in this PhD trajectory. Just some examples of pictures from the city of Rotterdam. So when you think of healthy environment, you can think of clean air, you can think of public transportation on the top right, you can think of playgrounds, green access in the city. So yeah, this looks all very nice and promising, but then this is of course the unhealthy environment that we also have in the city. Lots of fast food outlets, tobacco shops, polluted air, scooters all over the place. Of course, we're known for our bikes, but we also have other types of transportation that is sometimes pretty dominant in the city and that we want to act upon. So the aim of my PhD project was to evaluate local public health interventions to improve health-related behaviors, and then also looking at ways how to improve or reduce health inequalities in the population. And we also focused a bit on the methodology, which I will not go into depth today in this presentation, but in order for local policymakers to understand better the value of natural experiments contributing to their policies. Well, what type of data did we use? There was the wish to build on existing data sources to be able to show that with the data that we have, we can do a much better job in evaluating important interventions. So we looked at data from the birth cohort in the city of Rotterdam, the Generation R study. So between 2002 and 2006, all pregnant women in the city of Rotterdam were invited and 10,000 participated in this study. And we are still following the parents and their children. So they're now 14 to 17 years old. And this is a very rich data collection. And then we also used data by the city of Rotterdam. Of course, we have health monitors, but they monitor much more. And for example, the leisure time monitor was used to get insights in sport participation rates in the city. And this we linked with other data sets to make sure that we could evaluate the interventions that we identified. So I would like to discuss 3 of the chapters that were part of my dissertation on physical activity spaces, food environment, and barriers that we encountered. But of course, I can also recommend the other chapters that we wrote. So chapter 4 is on sport event policies. Chapter 5 and 6, we did a systematic review on novel smoke-free policies, for example, policies to prohibit smoking in cars and the effects on child health. This is, for example, a policy that has not yet been introduced in the Netherlands, but it could be super interesting to, as a next step, to combat the burden of tobacco smoke exposure in children. We also looked at a systematic review in chapter 7 on infrastructure interventions to promote cycling. And then specifically, we focused on methods. How should we measure those changes? Chapter 8 is about non-response in health surveys, which is of course a big problem. If it drops, can you still relate this to health outcomes? And chapter 9, I will go into more depth today as well, which is more on the barriers that I encountered during my PhD when trying to build evidence on natural experiments. And here you find links if you want to read more. Feel free to do so. So first about chapter 2, which was about physical activity spaces introduced in deprived neighborhoods. And this work was published in Health and Place in 2019. So we looked at the introduction of those playgrounds introduced by foundations, the Cruyff, Courts and Krajicek foundations. I think Johan Cruyff does not really need an introduction. He's, I think, our most famous football player, or soccer player, maybe I should say, from the Netherlands. Richard Krajicek, maybe in the UK, also doesn't need an introduction. He was the winner of Wimbledon in 25 years ago. And they both set up a foundation aiming to support physical activity and outdoor play behavior in children from lower income neighborhoods. And here you see two examples, and I think what is very characterizing of those playgrounds is that they are well maintained. They are built together, well, not together, but at least the local population has a word in how they are designed and what type of sports should be facilitated. And there's 9 hours of supported or visioned programming on those fields. So local sports clubs or sports coaches come to those places and give training which are freely accessible for all that want to join. And we wanted to know, does this improve outdoor play behavior in children that live nearby? Well, we made use of the Generation R data, and here you can see the timeline of the intervention. So at the age of 6 years, we selected children that did not live close to a playground. And then again, we looked at the same children that lived at the same houses in the same places, and we evaluated the change in outdoor play for children that gained access to a new sport facility as compared to those among which nothing changes. And I think the nice feature of this design is that some preferences that might be linked both to how your environment looks like and your behavior, those selection effects are minimized because the environment changes. It's not that people change place and this is how they became exposed. So this we did by linking access to physical activity places to the Generation R data, where outdoor play was collected. And these are some of the highlights of the findings. So unfortunately, we did not find that outdoor play was affected in the total population. But when we looked specifically into evidence for children from lower socioeconomic families, which were the target population of these interventions, we found that outdoor play seemed to be increased. But we also found that compensation may have occurred. So we also found that TV watching and gaming might have been increased for children that lived closer by those playgrounds. And here you can see that socioeconomic patterning of outcomes. And I think a clear limitation, what you can see here is that the confidence intervals are quite wide. So to capture those socioeconomic differences, you need a lot of power. And we may have lacked some of the power to show these changes. Then a third, chapter third, so the second example, on the food environment, we used a bit similar approach. So we linked again with the data from the Generation R study, but this time we looked at changes in the food environment over time. But as a side project, we did a little descriptive report for the local city council to show that the number of food outlets rapidly increased from 2004 to 2018. We see a 24% increase. And this is way larger than the increase in the number of inhabitants, which is 4 to 5% over the same time period. And then what we also showed is that it's specifically fast food that increased, but that the increase was larger in lower socioeconomic status neighborhoods. So here you see that in those neighborhoods, there was an increase of 75% in the number of fast food outlets. While in high income neighborhoods or high status neighborhoods, it was only an increase of 5%. So again, we see a large patterning of changes in the environment. When we look at fresh shops, like a cheese shop or a bakery, then you see actually the opposite. So a larger reduction in the higher income neighborhoods. And this was something very unexpected and very surprising for the local government. So although they knew that fast food was really getting dominant in the streetscape, they did not have that picture in mind that it was such a big difference between neighborhoods. So a very simple descriptive report, but very powerful for local policymakers. But of course, as an academic, we wanted to go one step further, and that was also link those changes to changes in obesity. So that's what we did by using data from Generation R. So first, we evaluated if exposure to the food environment differentially evolved over time for children from lower and higher educated mothers. And then we also wanted to know the impact of those changes on body composition. Well, this work is under review at the moment, but what we found is that there are large inequalities in the exposure to the food environment in the city, also when you link it to individual data from the Generation R study. So when you look at low educated mothers, then 39.7% of the children were exposed to 4 or more fast food outlets close to their home, while this was only 20.7% for children from high educated mothers. So you can see that at start there was already a large deviation between the groups. And then when we look at changes over time, so here you see the number of fast food outlets around home over a 7.1 year period, the change in the number of fast food outlets, then you see there are quite some children that nothing happened. There were some children where less fast food outlets over time were introduced, but then there were more children, here you see the distribution, where the number of fast food outlets increased. Well, this is of course a worrying picture again. And then when we plotted it as density plots and we look at the 4 different education levels of the mothers, you can see that this shift to the right, this shift in distribution, went to a more unhealthy environment more rapidly for children from lower educated moms as compared to the other educational levels. You can see the patterning here. So this raises some questions if this then also the shift contributed to obesity. But I think it's very important that those changes, so naturally occurring changes, there was no policy intervention here, that those changes were relatively small. So most kids, nothing happened, or maybe 1 or 2 new fast food outlets opened in their neighborhoods. And given the high amount of fast food already at baseline, we did not detect that the relatively small changes had an impact on their BMI. So that is then also the highlights of this study. So first, we did find evidence of widening inequalities in exposure to fast food around home. But then when we related this to BMI, this did not seem to have an additional impact in contemporary context with many fast food outlets being available. And I think here you nicely see that we had a bit descriptives that was used for local policymakers, and they were pretty amazed by the results that there are so many things happening in the city that they didn't have in mind yet. Together with the academic question, this contribute to obesity, where we did not find evidence that these small changes had an impact, which does not mean, of course, that there's no impact to be expected from the fast food environment on health, but perhaps that we could pick this up in this study design. And then I would like to tell a bit more about the experiences that I had during my PhD to evaluate natural experiments. Together with colleague Francisca Vargas Lopez, we wrote this down as a type of essay / commentary that we're still trying to plug in somewhere in the academic literature, which we called the paradox of getting control over natural experiments. Because one of the features, of course, of natural experiments is that as a researcher, you cannot control intervention and control assignment to individuals, but actually you want to have some type of control over the evaluation to make your life a bit easier, ideally. And we gave some suggestions in this paper, and I would like to share that with you as well. So they are not only hallelujah. I tend to say that because sometimes they are pitched as the holy grail in environmental research, but I think this is a bit too much, and there are many things that makes it difficult. So of course they are unpredictable when you think of future projects to be evaluated. For example, infrastructural interventions, they are sometimes delayed. When you think of new policies, well, given COVID-19, they can come super fast, and you do not always have time to properly evaluate or monitor those changes up front. Also, when looking backwards, it's sometimes difficult because you have the challenge of linking data, and especially data collected years ago. They are not always GDPR proof, and it's sometimes difficult to link those data to essential sources that are needed. And this is costs a lot of time. That's at least my experience from the Netherlands, to link those data, get access to those data. It really takes a lot of time. And another point, what I think is making it difficult sometimes, is that the evidence derived from natural experiments are not always well valorized. So it would be very helpful if they are more embraced rather than seen as an alternative of RCTs, but then the weaker part of getting evidence. But I think they are very powerful also on a local level to better understand how policies and interventions can contribute to health and health inequalities. But this valorization can definitely be improved. I also shortly want to mention 2 evaluations that did not work. I presented them in chapter 10 of my dissertation. I think it's very uncommon to reflect or line out projects that did not work at the end, but I think it's really needed to highlight those issues, because I think we can learn from them. One that I still hope to evaluate one day is the school-based intervention, which we call Lekker Fit, which is about physical education classes in primary schools. And we lined out a triangulation study using different data sets to see how overweight and obesity was changed. And I think key component here is that intervention and control schools are different, because children that were at risk, those schools were targeted. So by definition, those schools differ, and we cannot compare them just one-on-one. We need to have clever research designs, and that's why we thought we needed those different data sets. So we aim to use data from intervention schools, because they yearly monitor children on their body weight. We wanted to use data from the birth cohort study, Generation R, because that will provide us information on intervention and control kids. And we also wanted to use data from the city of Rotterdam, because once every 5 years, all kids would come to the research centers, and this data would also be very valuable. But having access to this data and allowing us to link the data on an individual level is really, really challenging. I think we're now 2 or 2.5 years in trying to get those data, and hopefully one day it will come, but they are still figuring out if we're allowed to or not. But I would like to highlight this study because I think triangulation is really a way forward for natural experiments, where we combine evidence from multiple data sets or from multiple countries or multiple time frames to study the same problem. And that will really help to strengthen our evidence base. And then the second study that I would like to mention is the intervention where the Dutch railway operating company announced to introduce taps at train station, so that 90% of the train travelers would have access to free water. And we aim to study this by means of a survey among train travelers. We used sales data from train stations, and we wanted to evaluate this based on plastic littered at trains and train stations, and we wanted to do this prospectively. So they announced this is in 2019, and we had multiple measures in 2019, and then we wanted to repeat this in 2020. But yeah, then COVID came, and the advice was not to travel by public transportation, and I think many people were not willing or trying to use taps because of the risk of becoming infected. So unfortunately, we had to stop this study because we could not have a proper after measure, but it was a very promising approach, I think, to prospectively evaluate such a large environmental interventions. It would be installed at 200 train stations in the Netherlands. But unfortunately, we had to stop this study. But I still think it's important to show that this was one of the interests, and I think given that in academia we very value publications, but these type of experiences are hardly being published. I think it's good to know that those examples exist, but did not really work out well. Well, some essentials for the local focus, what makes a natural experiment a success, or what makes it that you're actually able to evaluate. I think it's very important to be visible for local policymakers. So being one day at the city of Rotterdam, listening to their conversations, to their struggles, hear about their data sources, I think was very valuable for my PhD project. With natural experiments, I feel it's very important to be creative. Data is never easy to access, and you have to be very creative of using different sources owned by different persons. And I would really say, yeah, dare to explore and dare to invest time in relationships to be able to get those data. Another tip would be to ensure free time in your planning. I think when we write for research grants, then often you have those work packages and your deliverables per month or per year. But natural experiments are often not controlled by the researcher, and it would be very nice to have more time in your agendas or in our agendas to make sure that we can evaluate what is interesting. And I think what's really essential for me is that I really aim to disseminate my findings to a wide audience, both within but also outside academia. And I think it needs other types of materials and skills to disseminate findings to, for example, policymakers or people working in practice. So some training would be very, very much needed here or helpful as well. So what about the future? I think it would be very good if we as researchers are involved in early phases of intervention and policy planning, so that we can make sure that no opportunities are being missed. While being at the city of Rotterdam, I discovered many potentially interesting projects, but unfortunately we were not involved in early stages, and therefore some linkage of data or some essential study design characteristics were missed. And I think it will be very helpful if in future we are much more engaged at an early stage. I think it will be very helpful as well if the understanding of studies based on natural experiments, if this understanding would be improved. Sometimes people try to mimic an RCT, but I think we should be very clear that at the end it's not an RCT, but that the evidence you generate might be as powerful as some other types of study designs, and that each study design has its weaknesses and its pros, but that people should be aware that natural experiments can also provide very strong evidence. And another point to discuss perhaps, or where I think in the future we would benefit from if this would be changed slightly, is the academic impact versus policy impact. So while being in an academic center, my academic impact is being rated on a yearly basis. And although much more focus is nowadays on societal impacts, I still feel that this can be definitely improved to ensure that researchers also invest time in engaging with policymakers and making sure that their understandings or their research findings are well understood by policy or by people working in the area. And I think that this is very, very important because natural experiments are often giving very powerful evidence because they study real world changes. And these are just some examples how we try to do that. So we were invited to contribute to the local policy or the local newspaper and tell more about our research on playgrounds. We were also consulted with the new sports nota within the city of Rotterdam. We tried to make dissemination materials that are easily accessible for outsiders. So for example, at the left you see an infographic, and I think it very powerfully captures the main messages from our work on the food environment and how it changed over time. And we also noticed that those short, strong messages on Twitter are being picked up by local policymakers. So visualizing your results seems to be really key so that they pick up the important messages. And then this is an example of last week, which I liked a lot, because we, in SPHR, we often aim to have the researcher, the local expert, and the policy advisor that together talk about difficult topics. And here, this is actually what happened. So it was an event hosted by the city of Rotterdam about a new law. Literally translated, it will be the environmental law. It's a type of law where local advisory bodies, I think municipalities is a good word. The municipality has much more to say about the environment in its city, and they can make decisions. So it's not only the national level, but also the local level that can be very influential. And this was an event where we again emphasized that this new law can be a very nice opportunity to improve our environment and shift it towards a more healthy environment. And these type of interactions, I think, are also very important, that if they will change something, then of course I hope that they will think of us as researchers, that we can jump on this train to make sure that those important lessons are learned and that we can evaluate new things while being implemented. So for future projects, my main interest would be the environmental focus, to see how we can support health behaviors by focusing on those environments. Another area that I like a lot is how to reduce those inequalities. It has often been said that those environmental interventions are more equitable, but it would be very good to also support this with evidence. And I very much like the local focus, so to support local policy making. And I think those 4 years of my PhD was a very nice time to make those connections and links with people that might be of interest also for the future, to be collaborating with, to evaluate some of the interventions that will appear. So some of the topics that might be of interest, well, I studied nutrition and health, so I very much like studying the food environment and how it interacts with dietary behaviors and health. I also really would like to see how we can strengthen the evidence on smoke-free policies, for example, smoke-free cars. In the Netherlands, we don't have such a law yet, but we conducted a review that will be published very soon in the Lancet Public Health that showed that this is actually a very good idea and might be a very promising strategy to be implemented. Evidence, for example, from the UK, which was very valuable, and I think when such a policy would be introduced in the Netherlands, it would be super interesting to see if we can also capture those effects and look if they also were able to, for example, decrease inequalities in smoking uptake among children or smoke exposure for children. And then another area that might be of interest is the local COVID-19 policies. What we see is that policies are made in all types of domains. And I think the message will be very strong if we can make a case that you also need all different types of policies in all types of direction to combat other emerging problems such as obesity or smoking in the population. So to make that link a bit more clear would be very interesting to look at. But also I'd like to keep my time available to react on certain opportunities that may arise, which I think is a key to public health researchers that want to explore natural experiments. I think it would be very good if we all have a bit of time available to jump on nice opportunities that come at unexpected times. So this was my presentation and my last slide. Here you see my email address and my Twitter hashtag, so please stay in touch and in contact. I would be super interested also to hear about all the nice projects that take place in the UK. You have fabulous research facilities and also data sources to access. So there's definitely a lot that the Netherlands can learn from how you build evidence in the UK. So I'll be very interested to also hear from you. That was my presentation. I will stop sharing and give the word back to Frank for the audience.
Thank you very much, Famke. That was very interesting. A great PhD, and I'm sure you're very happy with the results. it's really nice to see what happens in the Netherlands, and your plans. And I think there's a lot of things that touch upon what we are doing in the UK as well. And I'm using we in the broadest sense of the word, especially with respect to, as you mentioned, triangulation. There, I'm sure there's some very interesting collaborations that could be forged on the back of this presentation that you gave to us. I'm sure there's loads of questions because there's so much overlap from other people. So please type them in the chat, and I'll try and manage that. In the meantime, while everybody is thinking and typing, can I ask a question? You mentioned, or you discussed a lot, and I fully agree with that, how important it is to work directly with policymakers and local experts to design and evaluate these experiments. I didn't hear collaborations with, or the involvement and engagement of the general public in Rotterdam. So I was kind of wondering if you could tell us a little bit if those were directly involved as well, and how that was done.
Yes, that's a very good question. I think also here I can clearly see that in the UK you're already a bit further in engaging with the public. It's also something we always have to tell, of course, there are journals when we try to publish in a UK journal how this happened. And then I honestly have to say that in our studies this barely happened. But there's also good news to mention that, for example, in the Rotterdam study, which is a cohort study more on elderly, there are now new projects where they try to collect some of the questions that the local population has to see if we can bridge their interests with academic interests. So there are some ways how this is being done, but it's true that it's very limited at this point that we involve the general public. And I think if we involve them, it's more about dissemination, so telling them what we found rather than asking them what they should learn us. Yeah, so this is not well explored yet, but it will definitely be something for the future.
Thank you very much. We have a question from Jacob. On one of your studies, the sports ground study seems to assume that it would be the children living closest to one who would be using it. Was this confirmed by a user study, or do you have other reasons to believe that crow-fly distance alone was a valid metric?
Yes, unfortunately, the Generation R study only uses questionnaires to capture outdoor play and sedentary behaviors, and we don't really know where those kids played. And I think this is, yeah, it's also one of the things that we encountered is that such a data source as a birth cohort run by Erasmus Medical Center, it's hardly used to evaluate local policies. It's very focused on more medical outcomes and in relation to lifestyle behaviors, but not really to study those environmental aspects. So unfortunately, they did not ask where did your kids play, were they supervised or not, these type of things. So there is a study from Amsterdam that showed that regular playgrounds are less often visited by children than those from those foundations. But again, we don't really know where those kids come from. So if the distance that they traveled, I think we used buffers of 600 meters, if this is appropriate or not, we don't have evidence or insights on that, unfortunately. But I really hope that in the next, so we have Generation R, but there will be a Generation R next. So they're recruiting out pregnant women again. And I really hope that during the coming 4 years, we can make, better visualize and capture in those data sources where exposures took place, what is relevant in terms of their environment. But at this point, we lack those insights.
Thank you. There was another question from Jerry, which is pretty long. Let me just read it out for the benefit of everybody. So one of the issues they have in Scotland is that the policy interventions they have available to evaluate aren't frequently very ambitious in relation to public population health. Do you think we should set out to evaluate interventions that are more likely to be negative, or even the causes of trends that are likely to be harmful, such as the rise in takeaway outlets that might not be the result of explicit policies, but implicit policies such as marketization, etc.?
Yes, I think in the Netherlands, I think on paper we have very ambitious policies every now and then, but then in practice it's sometimes difficult to see them. So on paper they seem very ambitious, but then when you're looking closer, then they seem to be, well, pretty small compared to the problems that we have. I very much like the idea of the implicit policies like marketization. I think it's also needed or useful for policymakers to have evidence on those type of policies and not only the things that they act upon. And another thing, what I feel that we do not always use, while it's super interesting, is to see all policies that were stopped for some reason. So rather than looking at the introduction, then at least in the Netherlands, for example, in the city of Rotterdam, we had air pollution going up, and then there was the idea to drop it. The policy was only 2 months in place, and then we had elections, and then the policy dropped again. These type of opportunities would also be much of interest, if you can expect in such a short time window that changes may happen. And maybe as an alternative, what I feel is also very interesting is maybe a bit more the modeling scenarios, that we inform policymakers by modeling, because we cannot always wait for things to happen and then to evaluate, but to inform them and make an informed decision on what to do. That could also be a way to build the evidence for environmental interventions when you cannot really rely on natural experiments or policies being implemented.
Thanks, Famke. So Sarah commented on that. I'll quote it again verbatim. I think there's a link here. Talking to communities may help us to recognize the negative effects of wider policy that need to be investigated and demonstrated, knock-on effects that are overlooked. And I think that's a very good comment, and I think it links into, so here in the UK, we've started to, in a way, look at or possibly even combine with natural experiments, system science type approaches. Have you guys been discussing that in Rotterdam, especially if you do involve more PPIs, so the general public, to discuss negative and maybe unanticipated consequences? Can build a wider system and all these feedback loops into evaluations.
Yes, we have a specific program targeting the southern area of Rotterdam, where you see much of the problems coming. And one of the first steps that a new PhD student will be working on is capturing some of those systems or factors affecting all types of outcomes. So it's not something we already working on, but it's definitely something also inspired by the work in the UK that we aim to look further into. And based on the negative effects, of course, we are aware of, for example, displacement effects or these type of things, but it seems very hard in our data to have evidence on those. So mostly we do have evidence on the positive sides, but then you have to be very lucky if also some of those negative outcomes are also available.
Thank you. Can I ask one more question, since there is no further question at the moment? So both of the examples you gave of the natural experiment that you evaluated had negative effects, so there wasn't any effect of the intervention. I'm sure this has come up during your defense. Could you tell us a bit more about why you think that is?
Yeah, I tend to think that it's mainly power issues. So it's, again, it relates also to the policies that are not very ambitious, or then in practice the changes are pretty small on the pace that we're evaluating them. So that makes it very difficult, again, to use such designs. And I think that was also maybe some of the things you cannot really predict from the start. So, for example, about the playgrounds, 13 playgrounds over time seems like a lot, and that seems very powerful. But then at the end, when we link this to the individual data, then it's appeared that we had far less children in the southern region of Rotterdam, where most playgrounds were built, and we had lots of observations in the north where the playgrounds were not built. So these type of difficulties, I think, are very common in natural experiments, where you cannot control the intervention, and therefore you don't really know at the start of a project how many will become exposed or unexposed. and that makes it very difficult. But yeah, the fact that we had so many negative findings, I think, relates to the magnitude of change over time that are relatively small given to all that is happening in the city already.
Thank you very much. I think that makes perfect sense. I think there's a new question. Sorry, it gets added to the previous one from Sarah. I'm wondering what people are thinking, doing in relation to the potential for using digital communication tools to capture changes and impacts on people. That's related to the fact that traditional data sets don't have the data needed. I think, again, that's a very good comment. I don't know, Famke, if you have a particular response or follow up on that, but I think it's more a comment than a question.
Yeah, I know that the city of Rotterdam and also more national data sets or researchers are very heavily involved in these type of debates, like what should we do to make sure that we capture the things that are important. For example, in Rotterdam, the leisure time survey, about 50% responded in 1995, and now we have a response rate of 15%, which is pretty low. Does it influence your outcomes? Maybe yes, maybe no. So definitely that we need other types of tools to capture the impacts of the policies or changes that occurred. I have no clear answers on what happens at the moment. I think we're still relying mostly on questionnaires, but we also, yeah, maybe a nice platform is the CBS data, so the Central Bureau of Statistics, well, the Central Statistics Office of the Netherlands. They have a nice research facility where, as a researcher, you can access individual data on, for example, declaration with your health insurance, the taxes that you pay. So we have a good estimation of your income. We know their date of birth and the country of birth, for example. And this is now also being linked to health monitor data that then still relies on surveys, but at least those surveys can be linked on an individual level to other type of data. So these, I think, are the current developments in the Netherlands that I'm aware of.
Thank you. Yeah, I think that very much aligns to what happens here. There's no more questions, so let me finish this by saying thank you very much again, Famke, for your talk to us. You've given us your contact details, so anybody who's interested in specific things can pick that up with you directly. So really thank you very much. And again, congratulations on your PhD. Let me just finish with one quick slide about the network, just so that everybody knows, because I realized this was an open invitation, so not everybody would have heard of the NIHR School for Public Health Research network for the use of natural experiments in public health. And I just wanted to give the link here because we have opened up for non-SPHR members, so anybody interested in this kind of research can join us, and we are still very much in the development phase, so there's loads of scope to shape this and to drive it in a direction that different people want. It's not a very complicated joining process. It involves just sending me an email or a DM on Twitter, and I'll happily add you to our mailing list. So with that message, I just want to say thanks everybody for attending. Thanks again, Famke, for the presentation. And I will contact the list again once we have our next event. If you have an idea, please get in touch and let me know. But thank you very much.